Welcome to How Positive Are You, episode number 33. Today we welcome Joan Shenton, who worked for the BBC and then was a top independent documentary producer with her company Meditel. She did documentaries for the BBC, Sky News, and other major media outlets in the UK and elsewhere. In the late 1980s, she started working on AIDS and the new drug AZT. The criticisms that she aired led to a harsh backlash, eventually destroying her career as a television journalist. That did not stop Joan, and she is still actively rethinking the HIV AIDS dogma. She participated in the RA 2009 conference, established the Immune Resource Foundation, where much of her historical video footage can be found, and is currently working on a new video. I'm here today with my co-host, Terry Michael.
Thank you, David. Before we begin our interview with Joan, I'm very pleased to have her with us today. Do you have any feedback that you've received from our listeners?
Yeah, there's some interesting discussions on the blog, howpositiveareyou.com, and that includes some positive comments about the show, and I'm not hiding the negative comments. There haven't been any so far. Annie from South Africa, regarding John Lauritsen on episode number 30, said, "Yet another awesome interview. Wow, what an amazing and articulate gentleman John is. It was a real pleasure listening and even hanging on to his every word. Thank you, all three of you, and Christine too, whom I just know would have been sitting right by your side. Naturally, the Far Mafia used very different marketing ploys here in South Africa. Whites, Indians, and mixed-race folks are safe, even gay males of those racial categories, but the majority of disadvantaged black folks are doomed, especially pregnant women. Tragedy, given that pregnancy alone is a known likelihood for a false positive HIV antibody test, but of course they know that only too well." Another feedback came from Fabian in Costa Rica. "I'm really glad that you included Maria Gonzalez in episode 31. I was a little bit informed about monarchists in Mexico, and it's nice to know that there's a big group in Peru. I hope I can join you in the next meeting." And I think he's referring to RA 2011, which will be starting December 1st in Washington, D.C., where you live, Terry.
Yes, these 10 square miles surrounded by reality, as we call Washington, D.C. Well, let's get started here. Joan, can you tell us a little bit about how you got interested in the subject of HIV and AIDS?
Yes, Terry, thank you and David very much for inviting me on. And here I am it's pitch dark in London and cold.
That's unusual, isn't it? Rainy?
But really what happened, I suppose if I go right back, I was actually the victim of iatrogenic disease, doctor-induced, when I was given a whole combination of drugs when I was in my 20s. In Spain, in fact, it was because they thought I had cholera, so they wanted to sort of mask that. And they gave me medicines that are, chloramphenicol that were banned in England by then, and huge doses of penicillin. And I imploded, and I got something called drug-induced lupus. And I was really very seriously ill, and I had to give up my job then at the BBC. And I was 3 months in Westminster Hospital with this autoimmune inflammatory condition. And I became very, very interested as a reporter in those days in medical stories. And because I had suffered a drug reaction, I actually decided to look into drug-induced disease or doctor-induced disease or side effects to prescription medicine. And so we started off by doing a series called Kill or Cure for Channel 4 as an independent production company by then. And that series, it had 6 one-hour programs, was used, in fact, by University College London's pharmacology department as a teaching instrument. And we got a second series called Kill or Cure. So in the course of all of that, I've always been aware and on the lookout, in a sense, for stories which surrounded injury from prescribed drugs. But when AIDS hit the scene, because we were specializing in medical stories, everyone said, you must cover AIDS, you must cover AIDS. And I said, well, what are we going to do? Everybody's doing a valiant job. You know, the world is fighting AIDS. This is very serious. And I'm not going to, you know, get involved with that. But then, in fact, Jad Adams, who in the end wrote a book called AIDS, the HIV Myth, he was working with me. And he actually went to America with Michael Verney Elliott to research a story about bad blood, because Michael felt gay men were being unjustly accused of infecting the world with AIDS. He thought it could be that there was some contaminated blood that was causing the problem. When they got to America, they couldn't make that story stand up because they literally didn't have the evidence for the orange juice bottles with contaminated blood coming in from Brazil, which is what allegedly was happening. So Jad actually read in Harvard Library the proceedings of the National Academy of Sciences journal called Cancer Research, and read the Duesberg paper there. And it just was amazing to him. And he flew back with Michael and we discussed it. And we took the idea to Channel 4 to make a program about Peter Duesberg saying HIV wasn't the cause of AIDS. And that's how it happened. That's how it started.
Tell me the time frame then when you first got interested. That was before roughly 1987 when Peter published his paper. You had been on the case for a couple years? Or?
No. You see, we hadn't touched the AIDS debate.
Not at all.
Until Jad read Peter's paper in PNAS. And then Jad produced a program with Michael. I was, in fact, executive producer of it, and he produced an award-winning film. We got the top award in British television called the Royal Society of Television's Journalism Award.
Channel 4 is the major independent network station in
yeah.
Correct.
And we did it for Channel 4, and we were absolutely amazed that we got this award as a tiny little production company, the first time ever an independent production company had got one of these awards, and we thought we were going to change the world. But, you know, it all fell into a pool of silence.
Can I just give a little timing context here? My database indicates that the PNAS paper Proceedings of the National Academy of Science came out in 1989. Is that correct?
No.
It was before then?
Or was it Cancer Research?
Cancer Research was 1987.
That one.
Oh, okay. That was the first. That was Duesberg's first shot across the bow. And that's when things started to fall apart for him. That was it. And that we called the film AIDS, the Unheard Voices then. What kind of reaction then did the piece? It won an award, but in terms of popular reaction, what kind of feedback did you get from viewers? Did you get absolutely nil? People were completely stunned. Nobody, in fact, reacted until we went on and made the second film called The AIDS Catch, and then the entire scientific and journalistic establishment fell on top of us. And how did they fall on top of you? Well, firstly, the newspapers like The Guardian and The Independent were extremely hostile. Then there were the pharmaceutical companies phoning Channel 4 and trying to get the film injuncted. And then there were people saying we were mad, phoning above our heads to the people running Channel 4. Did you feel that this pressure was coming maybe from across the ocean, from our CDC or our NIH, via the imprint that we have sometimes in the world on just about everything, or was it coming right out of the British government? No, I think that there were NIH pressures because Gallo obviously was there, and people like Robin Weiss and Jaffe wrote a piece, I can't remember the date of it, in which they completely demolished or tried to demolish Peter Duesberg and said, there's no point in discussing this anymore. So the virologists of the world got together and
and tried to destroy Peter's case. And from then on, everyone said to me, whenever I wanted to discuss it, they just said, well, there's no point in discussing it because his peers have told the world that he's wrong.
I'm curious, let's take other countries in Europe at the time. Was the same thing happening? Was everybody in consensus at that point? Germany, France, with U.S. and UK view on the single pathogen theory of AIDS? Yes.
I mean, to be honest, apart from Carvey Schneider and the Berlin cable channel, there was very little dissidence. However, you asked me who are our chief opponents. They were the Terence Higgins Trust here, and a very, very angry gay lobby here, who in fact ended up eventually taking us to the Broadcasting Complaints Commission and saying we'd been and we were found guilty of being unfair in our treatment of the subject of AIDS, and that was the Terence Higgins Trust.
But another big connection with England is, of course, that 1987 is when AZT came out, and that was produced by, I guess at that point it was called Burroughs Wellcome. It's now GlaxoSmithKline.
Yeah.
So the first and probably most significant AIDS drug ever was a British product, although it was designed with American research and, no royalties paid to the U.S. government. But England definitely had a big interest in the financing of the whole AIDS dogma.
They did, and I can remember the day AZT Cause for Concern went out, they're called the Wellcome Foundation.
The Wellcome Trust.
Well, the trust
is different than the foundation?
Yeah, the Wellcome Trust is actually the charity that runs the historical museum.
Okay.
And the Wellcome Foundation is the company limited.
Okay.
And their shares fell quite dramatically that day. And, of course, they were very, very worried. But they didn't fall for long. They went up again.
Right. I mean, the same thing happened after the Concord trial of AZT, where the drug company Burroughs Wellcome wrote a little note in the paper saying that basically we withdraw from this. We're not happy with this being published. And their shares fell temporarily, but it didn't last for very long.
I'm wondering if there was any traction at all that the Duesberg opposition to the single pathogen theory, was there any traction at all in the gay community in London and UK? Did anyone want to even discuss the possibility that something else was causing AIDS besides a mysterious retrovirus?
Yes, there were gay men. I mean, people later on, like Hugh Christie and Michael Verney Elliott, for example, was an absolute... he was a hero in all of this. And Hector Simpson Gildemeister, of course, the people we were working with were gay. But the anger that was coming from the Terence Higgins Trust, who were, of course, getting all their funding based on the infectious hypothesis, was powerful, because the Terence Higgins Trust had a lot of money in those days, and they were supported by Wellcome to a certain extent. So they were very vociferous. Yes, there were gay men who were supporting us. I've forgotten, there was something else I wanted to add, but ask me something else and it'll come.
And you're busy again, but there must have been a few years where you just went off and did other things because you were unable to produce documentaries in this area anymore.
Yes, I actually feel very excited now. Yesterday was our first day of filming, in fact, our second day for filming for the new documentary, which is called Positively False, Birth of a Heresy. And it's going to be an hour and a half, and it's going to make use of the Immunity Resource Foundation archive, which has now got 60 hours of digitized material, which we took from our old master tapes. And actually, David, you've been very helpful because you've sent us the material from the Oakland conference, the RA Rethinking AIDS conference, and I'm so excited because I really haven't done any television really since. I did one program, and it's 12 years, I think, almost. And yesterday, I didn't sleep last night because we were all over London doing to-camera pieces outside all the places where our offices used to be, the Broadcasting Complaints Commission, outside Channel 4. Oh, so exciting.
So in those intervening years, what were you doing professionally then?
Well, I dropped out for a year to write the book, and that book took over 2 years. Yes. And then when I tried to get back into television, I couldn't. So I did all sorts of things. I made educational videos in hospitals about colonoscopies. I filmed operations and made videos for surgeons. And then I've been an administrator in a small law firm in the city of London, a very tiny little
Had your
firm.
educational background included some medical education or science education?
No. Our school, boarding school for girls in Surrey, England, that I was sent to from South America, actually hadn't got the money for a science teacher or a science lab. So I got no science. I got a bit of O-level biology, but didn't even take it at O-level, I don't think. I never had any science. And then I was totally fascinated. I always say...
Teach yourself. You taught yourself enough science then to understand...
I didn't teach myself. I always say Peter Duesberg, when Jad, Peter, and Michael, and I, we in a sense, I feel I was shoved through some kind of undergraduate degree in molecular biology by Peter Duesberg et al., because that was when I just became completely obsessed with it. It was just so fascinating.
You know, at some point in the last 4 years, when I started doing all the reading, because before 4 years ago, as a gay man and the epicenter of the HIV equals AIDS paradigm, Washington, D.C., near the NIH, the CDC, I heard or read that at one point in the UK, there were more AIDS non-governmental organizations than there were AIDS cases. Have you? Is that? Am I simply not remembering something correctly, or somebody made that claim?
Well, I've not heard it about England, but I'm sure it's true, and you've reminded me of the point I wanted to make. The animosity that came after our programs was often from people who were on enormously high benefits. They were getting up to £600 or £700 a week.
Wow.
It was so big. That was clamped down on a bit. But free cars and anyone who was HIV positive was on huge benefits.
Just positive, not ill, just positive?
Yeah. Anyone. And I know them. And some of them were working with us. And I remember going down to Bristol, and I thought I was going to make a useful contribution to a group of women who were HIV positive in saying that aren't they lucky, they're not going to die necessarily. And they turned on me. They turned on me because they were queens in their environment, and they were getting a lot of money.
Yes. Well, that's the HIV/AIDS industry that we know so well.
It's hard to believe that people would sell their lives to the devil for filthy lucre, but human beings are amazing.
Well, this is what we're facing right now in the United States, year after year after year, as AIDS recedes, even by the CDC's Centers of Disease Control's own numbers, in the number of people who allegedly have AIDS or who are dying of AIDS. Every single year, there's the drumbeat for more money, more money, more money. It's just become a cottage industry. I'm guessing, and it's hard to find the numbers. There are at least 5,000. We call them nonprofits. The rest of the world calls them NGOs.
Yeah.
In the United States, I think there must be at least 10,000 nonprofits in the United States operating on the HIV/AIDS. In Washington, D.C. area alone, a 2 million metropolitan area, there are 90 organizations that deal with HIV and AIDS. They have huge staffs, huge budgets. It is a huge industry.
It is, and again, you've reminded me, when we were filming in Uganda, and we interviewed the Minister of Health there in the early 90s, he was desperate. He said, I have 300 NGOs invading my country, and I don't know what they're doing, and what they're funding, and what blood they're taking out, and I can't control. I have no control over them. And he was the Minister of Health.
Well, yeah, there's been a big impact in Africa in particular, where there is almost an infinite amount of money for AIDS to distribute condoms and to test people, things like that. And yet when it comes to basic healthcare that might actually save lives, it's actually negative, because anybody who's smart is going to get into AIDS. Like, why would you do standard healthcare when you can earn so much more money in AIDS?
Yeah.
Let's talk a little bit about the question of the HIV test. I have seen that in the UK, the government does not recognize the I'm losing it. The second test.
The Western blot.
The Western blot.
Yeah.
Can you tell us a little bit about that? Why there's this?
Yes. Well, Philip Mortimer, when he was head of the PHLS, which is the Public Health Laboratory Services that now has a new name, he became very worried about how unreliable the Western blot was. So he set guidelines which actually were adopted by the World Health Organization to say you don't need a Western blot. You can efficiently tell if people have HIV with a double ELISA. But because Scotland has a different law from England, Wales and Northern Ireland, Scotland said, oh no, we need a Western blot to prove that somebody is positive. So we took 16 blood samples and tested them in London on ELISA, double ELISA, and then we took the same blood samples up to Scotland and tested them, and the confirmatory test was Western blot there. And half of them tested either positive or indeterminate in Scotland that had tested negative in England. That's the degree of unreliability. And I've spoken to Philip Mortimer several times, and he has always said that he believes double ELISA is the only way he wanted to operate, but that of course, you know, there are different guidelines and different laboratories do different things.
And how with any testing algorithm, I mean, you use test B to validate test A, but there's always the question of, well, what if there's a false positive on test B?
I know.
I've been told with a straight face by people that there's no such thing as a false positive Western blot. Well, the reason people think that is because they don't confirm it. The Western blot is assumed to be true, so how could you have a false positive? Because you've got nothing to confirm it, and if you did, then you'd go on to test D, and okay, well, how do we know that's true?
Yeah.
Of course, the overarching problem here is that it's not a test for a virus active in the body. It's a test for a set of proteins, an array of proteins, one or two proteins that are believed to be specific to antibodies to this genetic code written in nucleic acid. So, again, it's a test about nothing if you believe, as thousands of us around the world do, that this is not a pathogen, as Peter Duesberg believes. So it sort of becomes a moot point as to whether one test is any better than the other test. If it's a test about nothing, they're all worthless.
I know. Well, we did a series of very small experiments, and we were helped a lot by the Perth group, by Eleni Eliopoulos and Val Turner, on this for Channel 4 when we were developing a program for World AIDS Day 12 years ago. And we got quite a lot of development money, £17,000, and we went quite seriously into small trial. We had 39 blood samples. We ran them through 3 different test kits. They were 3 test kits that were being used at the time, and they were, I can tell you what they were. They were Murex, Organon, and Pasteur. And we went through an institute through the University of Surrey, and it was all blinded, and they were put through 2 runs, and they were sent to a laboratory. We didn't know which one at the time, but it ended up being University College London's laboratories. And the result was that the first 2 test kits, which were Murex and Organon, produced pretty consistently similar results. And the ones we knew that were positive tested positive. But when they didn't send us the 3rd set of results, and I wondered why, so we asked them. And they said, oh, well, okay, you can have them. Yes, we're satisfied that we've done everything we can. And 19 of those in the Pasteur test kit were indeterminate and some verging on positive. So that was a huge difference. And they would have needed retesting. So in those days, with 3 different test kits, you can see the differences that were emerging.
So the point is, even if the test is about something, even if it is a marker for something, the tests are obviously not reliable.
No, and then the thing that fascinated me was that there's something called the Protein Research Laboratory down at St. George's Tooting, and the Perth group had said that I should go there and ask for people with high IgG or IgM proteins. That's a kind of hypergamma-globulinemia condition. So we got the samples from 4, we could only get 4, people with no AIDS-defining diseases, but very high in IgG and IgM. And of those 4, 1 tested definitely positive.
Tell us a little bit about the current state of both public and government interest and obsession on AIDS, on testing, on HIV testing in the UK. Do you think it differs much from the everybody's got to get tested kind of approach that our CDC and NIH and a lot of the local government agencies in the United States are pushing, particularly here in Washington, D.C.?
Do you know, I notice here that we don't have that urgency. The everybody's got to get tested thing is not high profile here at all. In fact, nobody talks about AIDS anymore. There used to be an all-parliamentary committee on AIDS. I don't even know if it exists anymore. But I don't see this public move to test everybody that I've heard is happening in America.
In Washington, D.C., I can tell you that it's ubiquitous. You go in bus stops, transit advertising, advertising in the gay publications. It's just everywhere. That it's almost that it's your responsibility to be tested, and that is obviously being pushed by the drug companies, and also because of the way we fund it. If the local HIV/AIDS administration in Washington, D.C. captures a new HIV positive, they get a couple of $1,000s from the Ryan White AIDS Fund, about $2 billion of money. So there's this great impetus to sort of push money to local jurisdictions by increasing their number of AIDS victims, their number of HIV test victims.
So they have a financial conflict of interest in that for them a false positive is a good thing because it brings in money that they don't deserve. And maybe they forget that person who tested positive, who's actually negative, has just had their life destroyed. Maybe that doesn't matter too much if you're working for an AIDS organization. I had another question, Joan. In all the development of your documentaries and talking to many people, did you come across some compelling stories of people who had been positive for many years and had resisted the drugs and were wondering why they were stubbornly staying healthy? Did you come across people like that?
Well, yes. I did, and I have since then at conferences, Rethinking AIDS conferences,
Mm-hmm.
and there's a chapter in my book which has a list of stories, but I mean I'm meeting them now, even younger people. We're having a screening of House of Numbers, Brent Leung's award-winning film, in London in March at a small cinema, and we're drawing together people who are interested through Heal London. And there's quite a lot of young people who have tested positive and who are perfectly well. I mean, one of them is an artist. She's very successful. She's had a son who's HIV negative. Another is a young woman who wants to remain anonymous, but we're interviewing her in silhouette for our film, and they are well. Of course, I have had experience, tragically, of the death of people who were HIV positive, like Hugh Christie, for example, whom I was really close to, and we worked together for years. He was editor of Continuum, and we shared offices. And he didn't recover, really. He sadly died, and I can't explain that easily. I can explain it only in that I understand that he took a lot of recreational drugs at one point in his life, and he told me so,
Right.
including poppers.
What is the treatment of HIV-positive people, like these women you've talked to? I know in America, if you were pregnant, it's a nightmare because they're pushing you to take AZT and they're threatening to take the baby away and you can't breastfeed and all those things. How is England with that, and also putting people in jail for having sex?
David, I'm not up to date, I'm afraid, on that. But Anne Blumenthal, who's making a documentary about the way AIDS has affected women, is very, very knowledgeable. And I would thoroughly recommend you have Anne on your show, because I had a long conversation with her the other night. She's been traveling right around the world. In fact, she's going to Russia, to Ekaterinburg,
Okay.
To interview the female lawyer.
Irina Sazonova?
Yes. Well, she's going to interview Irina Sazonova, but she's also going to interview the lawyer that took part in the Ekaterinburg conference.
Okay.
I can't remember her name. You might remember it, because she's been trying to defend and the women who have had their children taken away from them in Russia.
Right.
And this is a huge subject, David, which I would love Anne to be able to talk about, because I am not knowledgeable enough.
Well, that's a great idea. I hadn't thought of having Anne on the show, although I've been in touch with her, but we definitely should.
Yeah.
I'm curious, we probably in most metropolitan newspapers in the United States, excuse me, have stories about HIV and AIDS every week or two. In the London press, how often do you see stories about HIV and AIDS?
Hardly ever, and they're grossly misleading when you do read them. In fact, they make me so angry that I can hardly bear to read them. And in fact, I cut a few out, and I'm looking around my room now to see if I can find them, but I can't. They're just,
But it's not something that's a constant topic then.
No.
Sex and all that sort of thing. It's just not in the media. Is that correct?
Absolutely not. Occasionally, very famous personalities decide they're going to support an AIDS charity.
Well, Elton John probably is is he public in the UK the way he is about AIDS in the US? He's like the savior of the planet from HIV AIDS in the United States.
Yes, he is. And, whenever he says something about it, of course, it gets into the papers. But there's really remarkably little being said at the moment.
How much money being spent? Is the government spending much money on the vaccine research, or...
I'm afraid I don't know what the MRC figures are. I've been a bit out of it, as
Right.
they say recently. I'm not in the main swim of the politics surrounding AIDS, but you're encouraging me to get back in and find out more about these things.
Are there some new infectious disease paradigms that are maybe taking some of the attention away? Like England got pretty involved in the swine flu fiasco.
All that. Bird flu, swine flu, BSE, all that. But there just don't seem to be any AIDS cases. Again, Mike Hersey, who runs Heal London, he will probably know more about...
Well, let me just give you as an example. I mean, if we just look to Canada, where David is sitting right now.
Yeah.
I think it was 2007 or 2008, the comparable organization to the U.S. CDC, the Centers for Disease Control, reported something like 228 new cases of AIDS in Canada, in a country of 34 million people.
Imagine.
I mean, it's fewer than probably get struck by lightning or hit by trucks.
And yet in Canada, if anything, the treatment of HIV-positive people is even harsher than in the United States. I just talked yesterday to a man named Carl Leone who's phoned me from jail. He got a 21-year sentence, and if he had been HIV negative, his promiscuity while he was basically a teenager would not have been a crime, and yet because he was HIV positive, it became this massive crime, and he was demonized in the press and sent away basically for life. And on the basis of this being a deadly illness, and yet there's nobody around hardly who has it. They're desperate to find new victims.
That is so terrifying. I can't imagine how dreadful it would be. I remember when I was in Ekaterinburg, this lawyer telling me the story about these young soldiers that were coming back to Russia from Afghanistan, extremely undernourished and skeletal, and some of them tested positive, and they came back into the villages, and one of them had an affair with, allegedly, with 3 girls in the village, and 2 of the girls had tested positive, so he was imprisoned, and she tried to defend him, but she didn't succeed, and so he went to jail for 2 or 3 years, and one of the 3 girls waited for him till he came out, and he married her. Isn't that lovely?
Well, that's a nice story. It's nice to see something positive coming out of these things. I wonder if he was still positive when he came out.
I don't know.
Because if he was not malnourished, he probably ate better in jail than he did in Afghanistan.
Yeah.
So if I were in London right now, and if I were in a gay bar, would I be seeing lots of posters, signage about getting tested about HIV and AIDS?
No.
Unlike here, where it stares you in the face every...
Isn't that amazing?
With your new video, what's the angle that you're going to be taking? You're using a lot of old footage. You have some new people. Do you sort of have an idea what your overall message is going to be?
Well, I remember Christian Fiala saying to me, who is backing this project, he said, "Tell the story, Joan. Just tell the story." And that's all I can do. And Terry, you'll understand. I can only tell the story from where I stand and with the material I have. Mm-hmm. And so it's like a series of little stories that I'm pulling together to give a sense of background to this issue. And when you put all these little stories together, they accumulate into, I hope, something quite powerful.
Yeah, I see the benefit of that because this whole issue is so complex. You can get just confused down in the weeds of, are CD4 counts really increased by drugs and all these things. But if you look at it from an individual's point of view, they go to the doctor, they test positive, their life is apparently at that time destroyed, and then a number of things can happen, and those stories, do they go on the drugs, do they refuse the drugs, do they get sick, all of those things are very interesting.
Yes, I mean, obviously it's going to be a leap through 15 years. It's a leap through, but we're just going to thread it together and see what happens, what the outcome is. And I'm re-interviewing people like Jad Adams and asking him how he feels now all these years on. And, he was severely criticized, and people tried to black him through the publishers that were... he was writing books, nothing to do with AIDS, to those publishers, and they were told, don't deal with Jad, he's unreliable and unsafe on AIDS.
Tell me, did Neville Hodgkinson meet a similar fate in terms of his career? I really don't know whether he has suffered in his career from the Sunday Times, right?
Yes, indeed. No, Neville is going to be interviewed here in my very flat on Thursday this week for the project, and he threw himself into this with the Sunday Times and was supported by the then editor, but then Andrew Neil, that's right, and then Andrew left, and Neville found that he had no more support in this area, and he became very disillusioned, and he left journalism. But actually, he still writes articles, and he's enormously supportive, and he's coming to the screening, and he's being interviewed next week. So it's wonderful to have Neville.
When do you think you'll have your video finished?
At the end of April, May.
Of this year?
Yes.
Oh, wow.
What kind of outlet are you going to have for the video?
We are hoping to get cinematic release, but it's not realistic. I think it's more like DVD sales. I mean, it would be wonderful. We're going to go for the festivals, and the festival circuit is a year. Brent's film, House of Numbers, it won 13 awards and still doesn't have a distributor.
Yes,
I think it may have a distributor of some kind, not a big one, but I think it's astonishing that a film that can win 13 Best Documentary awards doesn't have a distributor.
It kind of reminds me of the whole WikiLeaks phenomenon where, especially in the United States, it's so demonized that a vast percentage of the population can't utter the word because it's unpatriotic or something. And AIDS is similarly like that. You mention the word and people's brains freeze and they can't think except they just want to get away.
Well, it's a problem not certainly just in mainstream media. It's a problem in gay media in the United States. If you would even attempt to write a piece questioning the single pathogen theory for a gay newspaper here, it won't happen. And I was successful, very unusually so, I think, just a couple of weeks ago in getting a piece in the Montreal Gazette around the Tommy Morrison case to finally find some kind of venue of a mainstream newspaper that would at least entertain an opinion piece, an analysis piece. It's almost impossible to get anyone to listen to you. They look at us like we're crazy.
But even when a piece like that is published, it's as if it exploded in a soundproof room. It's not like it gets picked up by. I mean, the Montreal Gazette is part of the largest chain of newspapers in Canada, and as far as I know, it didn't get picked up by another one of the newspapers. Calgary, Vancouver, Toronto, they all have newspapers of the same chain, and they're always picking up articles from each other. It's just like, the Montreal Gazette, opened the door a little bit and everybody else slammed it shut to make sure it didn't escape.
That's one of the reasons that we are going to try to stir things up in Washington, D.C. this coming World Afraids Day, or they call it World AIDS Day, December 1 through 4. This is in many ways, the epicenter. It is the epicenter of the myth. And hopefully, we're going to be able to do some education in local media in Washington and try to get them to cover this.
I think that would be tremendous, and I think that if you say in America the test is being pushed to such a degree, there must be a way of uncovering in a dramatic way how completely unreliable and ridiculous the test is, because that is what will make people's heads turn.
Yeah, unfortunately, that kind of thing would be rather expensive. I think to do a really thorough job of that, you'd probably need something close to $100,000 in funding.
Yeah.
In order to do it properly blinded. Use the best labs, all that kind of stuff. And of course, there's a complete starvation of funding for research like that. I mean, what you did was very interesting, but people would say, well, it wasn't a large enough sample size. It wasn't done by scientists. You have to get through all of those artificial barriers. And I don't know how, where we find I guess we have to wait until a millionaire son or daughter is killed by the AIDS hypothesis before we can have that money. What are your thoughts for the future of the Rethinking AIDS movement? What are some of your observations? You said you're quite a bit more excited now than you were a few years ago.
Well, I am. You mean the future of the Immunity Resource Foundation?
No, the AIDS Rethinking movement in general. What you see of it? The IRF and Heal London.
Well, there are two things. One is that I really. What you've just answered, though, is a bit discouraging. I think that we will win through what's the word I'm looking for? Undermining the information about the test, and we will win through the courts. I can remember following stories about drug injury, and particularly SMON, and Ciba-Geigy eventually apologized and paid massive compensation to the people who had been damaged by clyoquinol, an antidiarrheal.
Right, and to remind people, SMON or SMON was described quite well in Duesberg's book, and it was a disease that seemed to occur only in Japan. It was blamed for over a decade on a virus, and it turned out that they'd ignored the people who'd been saying for years that it was actually caused by this Ciba-Geigy drug. The viral hypothesis shut out the true answer for many years, and thousands of people died because of that.
That's true. Now, the thing is, in Japan, there was a tenacious group, several groups of lawyers, and the team I worked with, there were 9 of them, and they got compensation, £203 million in the end. In these days, doesn't sound a lot, but it was a massive victory for the toxic against the infectious hypothesis.
There was a really good case a couple of years ago in Boston of a woman who had tested positive, been placed on the drugs for about 10 years, and then she found out she was indeed a false positive, and she was awarded about $2.5 million by a jury. Excuse me. I thought that would be a wake-up call, but it didn't. It did not get a lot of traction. But it's cases like that. I'm really hopeful that we can see some class action suits because of all the gay men who, for now 15 years, were hit hard and hit early by the horrendous Dr. David Ho, and his idea that you needed to take these drug cocktails with no presenting illness whatsoever. You just need to start taking these drugs. And we've seen the results. We're seeing gay men dying of liver dysfunction, heart attacks, stroke, kidney dysfunction, who've been on these drugs for like 15 years. The body can only take so much poisoning, and they've been slowly poisoned.
So important, you see. If there could be a class action, and I know Peter got involved in the possibility of class actions to do with AZT ages ago, but it never happened. But when I saw what happened with Swan, and I followed the cases through the courts here in England, I saw that what is said in court and the proof that was provided in court, scientific, that it was actually this drug that was damaging the nerves, the nerve connections in people and making them blind and paralyzed, that changed it. Ciba-Geigy withdrew the drug, and that was that, you know.
The problem with this, of course, is that the gay men who've been taking these drugs for years have convinced themselves, well, you almost have to, that they had the disease and they took the sacraments of the High Church of HIV AIDS, and it has saved their lives. They would have died without it. Even when they look in the mirror and the face has wasted, the stomach has distended, the limbs have thinned, it's a religion in the sense of they simply cannot accept that they've been poisoning themselves. So really hard to find class action suits because people have just been brainwashed into thinking that the poison they've been taking was somehow extending their lives as opposed to making their lives miserable.
I had an interesting encounter with somebody on Facebook who contacted me, and I guess we connected because through some AIDS connection, and we had a little bit of a discussion, and he told me that he hadn't worked for 10 years, and I said, oh, why is that? And he said, I'm HIV positive. And so then I said, well, what diseases have you been suffering from? He said none. It turned out that he hadn't taken the drugs except for a very short time. And so I said, well, you know, there are people who believe that he said, I have AIDS because I have a low CD4 count. So he doesn't have an illness. He hasn't been taking the drugs. He's healthy. He hasn't been working. He's presumably been living on disability for 10 years. And I said, well, there are people who believe that a low CD4 count is not a disease. It's just a lab marker, and it might not mean anything at all. And maybe you're perfectly healthy. And at that point, he totally turned on me. He sent me the most obscene email, told me that I was ruining his life. It was completely bizarre, but I was disrupting his comfortable life.
You know, a religion is a very difficult thing to give up, and that's what we're dealing with here. It is a religious cult, and gay men have just basically been sold this bill of goods by their own government in the United States, and they simply are unwilling to give up the religion. Even in looking in the mirror, and physicians are the same way. How many doctors are you going to get to re-examine the question of whether these drugs are toxic or not, whether they produce iatrogenic illness? I mean, how many doctors are going to finally admit to themselves, well, I've been giving my patients poison for 15 years. Yeah, it's a huge, and the whole industry is pushed along by testing, by increasing the demand that everyone get tested, in fact, and that everyone get treated, even to the point now with I'm going to use the word lunatic, Anthony Fauci, promoting the idea that you should start taking these drugs when you're negative so that you don't become positive.
Is that really true?
Yes, they have. It's called PrEP, pre-exposure prophylaxis. He spent $40 million on a study, mostly using Peruvian prostitutes, male prostitutes. They certainly wouldn't have dared done it on white males in the United States. Try to prove that it stops infection.
Yeah, and in Canada, they've the Montagne, not Montagnier, or Montagneur, as some people call him. I don't know. He's Argentinian. He's been promoting the idea for some time. I think there was an article in The Lancet in 2006 that since AIDS drugs are quite cheap now, some of them are as little as $1 a day, every HIV-positive person should be put on the drugs as of day one.
Yeah, that's called test and treat.
Yes.
But they've kind of backed off on that in the United States, because I actually did a piece, I was able to get a piece in the conservative newspaper called the Washington Times accusing basically Fauci and the mayor of performing an experiment on black people in Washington, D.C., because they were going to promote the idea that once you test positive, you immediately go on the drugs. No matter what your CD4 T-cell counts, no matter what your viral load, no matter whether you have any presenting illness, just go on the drugs immediately, and that will keep the spread of HIV from occurring. It's really draconian. It is frightening, and they're getting by with it.
One thing I just wanted to pass by you is that when I was in Vienna at the conference there that was held before the World AIDS Conference, the dissident conference, one or two of the dissident doctors said that the drug cocktails, the protease inhibitor cocktails, provided an antibacterial, anti-inflammatory, and antimycotic treatment to people that was sometimes useful for a short period of time. In other words, they didn't kill a virus, but that used for a short period of time could actually damp down the cachectic state of someone who's in a huge inflammatory state, right?
Yes, we interviewed
the biggest problem, though, being that these drugs are given for life because everyone's terrified that if they stop giving them, then they're going to die of the virus.
They're cell killers. They're yes, indeed. If you have some bacteria, a cell-infected, bacteria-infected cell, yeah, it's going to kill that cell along with everything else. And and we know from our discussion with David Rasnick in a previous episode that there are antifungal properties of the protease inhibitors. Mm-hmm. So, yes, if you enter a chemical into the body, it can have many different effects. The idea, of course, is that it's supposed to be attacking a retrovirus, which many of us believe, of course, is not pathogenic. But it also is going to be like any chemotherapy. When you have chemotherapy for cancer, the whole theory is we'll give you a 6-week course of this chemotherapy. It'll zap these fast-dividing cells, and we'll hope that it won't kill you, but it will have time to bring you back to health after we end the instant chemo. But this is chemo for life.
Absolutely crazy. But it's a mass delusion because, the drugs are described in the newspapers as, quote, life-saving. They don't say these drugs can save lives, but they have significant side effects. You have to definitely read the fine print to see that. And if you repeat it long enough, you start to believe that it's true.
I see with it, I'm looking at my time code here, and we're coming up on the end of the hour. David, do you have any last questions?
No. Joan, if you have anything else you'd like to say?
I've really enjoyed this because it's stimulating me now to go and do a whole lot of things I haven't been doing.
Well, it's just been delightful. I don't know how much you know it, but you've been seen as one of the bright lights in the dissident movement, and certainly reading your book was one of the things I did in the early days that gave me a much better understanding of the human side of AIDS, and watching your videos, which are just remarkable. I'm just so excited that you have a new video coming out. I can't wait to see it.
You're an inspiration.
Thank you, David.
Donna, we look forward to seeing you at Rethinking 2011
in
Washington, D.C.
Really looking forward to it, Terry. Thank you for inspiring me.
Maybe you can screen your documentary there, something like that.
Absolutely.
Okay, thanks so much, Joan.
Okay.
Goodbye.
Bye.
Okay, bye-bye.